Hi, so today we're going to continue with our cardiovascular drugs and talk about some antianginals and antiarrhythmics. So we have to define two terms to start off with, angina and arrhythmias. So angina or angina is a medical term for chest pain. So very simple, just remember angina or angina, it's pronounced both ways. It may be caused by a number of different disorders and conditions, but this is important to realize that this is cardiac in etiology. It's not like this is heartburn. This is specifically chest pain related to the heart. Now, it might be serious and persistent. There's a number of disorders which could cause it, but serious or persistent angina might be a sign of cardiovascular disease or a serious heart condition. Now, arrhythmia is the medical term for an irregular heart rhythm caused by a problem with the electrochemical conduction within the heart. So there's this electricity, these electric signals that go through the heart and make it beat. And that can be detected by a EKG or ECG. You can see it right down there. Obviously, you don't have to memorize what each of these peaks and troughs mean, but just so you're aware, I'm sure you've seen these. And this is what a normal heart rhythm looks like when measured by an electric EKG machine. Now, an abnormal heart rhythm can interfere with the heart's ability to pump in an effective way, and that can range from anything like mild to life-threatening. So some people might just describe their arrhythmia as a flutter. Other people may be hospitalized with arrhythmia because it's that serious. So there are multiple types of arrhythmia, and it's good that you know these terms because it may come up on your exam. So we have tachycardia, which is a fast heartbeat. We have bradycardia, which is a slow heartbeat. Premature or ectopic beats. So there's normally a specific interval between when the heart beats. If that interval varies by a lot, then that could mean a premature or ectopic beat. And then there's also a flutter or a fibrillation, where these waves that you can see, the P wave, the R wave, the QR, the QT complex, all those things, if they're fluttering or fibrillating, they're not going to be that shape. They're going to be a different shape, and that spells trouble for pumping blood throughout the body. So just to illustrate this, as you can see, we have a normal heartbeat versus atrial fibrillation. So as you can see, we have normal heartbeat. That electrical activity is going from the atria into the ventricles in a organized way, right? So it's moving there, pumping those atria first, then the ventricles. It's going down in a normal way, an even way, and you can see it's reflected on that normal EKG reading. There's a normal distance between those peaks. The peaks are regularly shaped, should be fine, right? In atrial fibrillation, that electrical activity is messed up and it's propagating through the heart at different times. So the heart, because of that, is not beating in a regular way. So you can see these waves are disjointed. They don't come at necessary intervals between each other. They're irregular, and that could spell problems for pumping the blood adequately through the body. And that can also lead to heart attack, stroke, or any number of other serious cardiac events. So let's first start off treating chest pain, angina. We have our antianginal drugs, and they treat cardiac-related chest pain resulting from heart disease. So patients with ischemic heart disease, which is just a certain type of heart disease, they might suffer from a lack of oxygen and blood flow to the myocardium or heart muscle. So by using agents that increase circulation in the myocardium, that chest pain decreases. So we want to introduce more blood into the myocardium by dilating those vessels. By doing so, that is, those vessels are carrying oxygen through the red blood cells. They're getting into the heart, and they're supplying the heart with adequate oxygen so it can function better. Now, these are nitrates, are the mainstay for antianginal drugs. They relax the smooth muscles, dilating those coronary vessels, increasing oxygenation, increasing blood flow. And they're used more in cases of acute angina. So someone's not going to be chronically taking nitrates. They're going to take them when they need them and when they actively are feeling chest pain. Our two examples are nitroglycerin. Interesting, right? It's not TNT. You actually use it to you use it to cure or temporarily treat acute angina. So nitroglycerin or nitrostat. It's easy. I'm sure if you worked in a hospital, you know what stat means like right away. So nitrostat, it's relieving that acute pain right away. And the other one we have is isosorbide mononitrate, which is ISMO or IMDUR. Works the exact same way. We also have ranolizine or Ranexa, and that's for the chronic chest pain that's related to heart disease. So it relaxes the myocardium, that heart muscle, by reducing the flow of calcium ions into the heart. So why do we want to reduce the flow of calcium ions? Well, calcium ions affect the strength and rhythm of any sort of heartbeat, because calcium, an influx of calcium makes muscles tense up. So when you tense your fist like this, right? When you tense your fist, you are opening calcium channels. Your brain's instructing that to happen. You're opening calcium channels so your muscles can contract. So if you lessen the amount of calcium in the blood, you're able to mitigate those issues in the myocardium that would cause an irregular heartbeat, and it would reduce the chronic angina as well. Now, notes on nitrates. Nitroglycerin products have to be kept in the container they come in. You can see it's that little amber vial right there. It's actually really, really tiny, and those drugs are extremely tiny as well, those tablets. They are actually dissolved under the tongue. They're not swallowed like other medication. They are dissolved instantly under the tongue. They absorb right through the buccal membrane, as we would call it, and immediately you start to get that, or you should at least start to get that chest pain relief. So because they're so tiny and because they are an acute medication, we want to keep it tightly closed and out of reach of children. So tightly closed because humidity, temperature, and sunlight can affect the potency of the drug. And of course, we want to keep it out of reach of children because this medication works directly on the heart. So if a kid were to swallow even just one of these, it could give them an irregular heart rhythm and potentially be fatal. So as with any medication, but especially with nitroglycerin, you have to keep it out of reach of children. Now, nitrate products, nitroglycerin products as well, they cannot be kept for more than 12 months. If they're over 12 months old, they should not be used because they may have lost some of their potency. And the other thing to keep in mind with a nitroglycerin prescription, something you might see on one that you don't normally see on other drugs, is that most nitroglycerin prescriptions state you can take a tablet 1 to 3 times for every 5 minutes that chest pain persists. So if you take one, you wait 5 minutes, the chest pain is still there. You put another one under your tongue, you wait another 5 minutes, chest pain is still there. If the chest pain keeps persisting, the prescription then often instructs the patient to call 911 because that's a sign of maybe a heart attack or some other cardiac event that would require some specific medical care. Next, we have our antiarrhythmic drugs, and these regulate the conduction activity of the heart. So you remember that drawing that I showed you of the atrial fibrillation? That's when you would use one of these antiarrhythmic drugs. Now, they inhibit abnormal pacemaker cells, or recurring abnormal electrical activity. So basically, the point of antiarrhythmic drugs is to stabilize that electrical activity within the heart. So it is more standardized and more so that electrical activity is more regulated and you're not having these irregular heart rates. So we have 2 major antiarrhythmics. We have amiodarone, otherwise known as cortisone or pacerone, and it's available IV or orally. So you can see it in both hospitals or in a outpatient setting. It has lots and lots of drug interactions as well as with grapefruit. So again, it's one of those medications that you have to be careful with in terms of what you're prescribing it with and in some dietary issues as well. Side effects of amiodarone are pretty standard. There's a nausea, vomiting, diarrhea, also fatigue, and a possible lack of coordination. Now, digoxin is one of my favorite drugs because it relates back to natural products. As you can see right there, that beautiful flower is called foxglove. It's Digitalis purpurea is its Latin name. And it actually naturally produces digoxin as a chemical within its leaves. So it was originally synthesized from that beautiful flower over there. It turns out it's a very, very powerful cardiac glycoside that helps regulate heart rhythm. So digoxin is available in tablets. It's also a narrow therapeutic index drug, meaning that there's a very, very small window where the drug actually works without being underdosed or overdosing. So it has to be dosed very, very carefully. And because it has a ton of drug interactions as well, several potentially severe drug interactions, in fact, you have to be extra careful with that dosing. Now, side effects for digoxin are also pretty standard. It's nausea, vomiting, diarrhea, headache. The one interesting one is yellow halos in vision. So if someone is experiencing digoxin toxicity, then they're going to have what looks like yellow halos around objects in their vision. Now, this doesn't change the color of anything on their skin. It's not like they're jaundiced or that their eyes turn yellow. It's literally just a visual disturbance where there's like a yellow film over everything they're seeing. So I would make sure to counsel a patient on that, just in case they start seeing yellow halos around things, because you can only tell if it's a patient reporting. And that's when you can adjust potentially the dose of digoxin. So that is all for antiarrhythmics and antianginal drugs. As always, if you have any questions, you can feel free to contact me. Thank you.